Good evening and welcome to our COVID-19 update. I am Ladi Akeredoluwale. Here, the highlights of this are: Edo State government laments non-adherence to COVID-19 protocols by residents as death toll hits over 100. National Examinations Council releases guidelines and schedules for public examinations in the COVID-19 era. And Nigeria gets 200 ventilators from the United States to battle COVID-19. We begin in Benin City, the Edo State capital, where as the COVID-19 death toll in Edo State hits 100, government there is urging strict compliance to protocols amidst the electioneering campaign for the governorship. The Edo State government has asked residents to ensure strict compliance to set guidelines to prevent the spread of COVID-19 across the state. According to the Commissioner for Health, Dr. Patrick Okundia, who decried the alarming rate of community spread, he explained that the state has recorded 2,398 confirmed cases and 11,871 suspected cases, adding that state surveillance pillars is presently carrying out contract tracing, line listing, and contact monitoring of all confirmed cases. Dr. Kodia reassures that the state government will continue to intensify efforts to contain the pandemic and protect citizens, especially the elderly who are most vulnerable to the virus. All right, from Edo State, we move on to the National Examinations Council. The National Examinations Council, that's NECO, has released guidelines and schedules for public examinations in the COVID-19 era. Briefing journalists at the council's headquarters in Minna, the Niger State capital, the NECO registrar, Professor Godswill Obioma, announced the new date for NECO SSC exams as October the 5th to Wednesday, November the 18th. On the guidelines for the conduct of the examinations, Professor Obioma emphasizes the need to preserve existing protocols like the contamination of venues, hand washing, wearing of face masks, and others. So far, over 350,000 students have registered for NECO's basic, senior, and common entrance examinations nationwide. Let's move on to Ogun State, where the government there, that is the Ogun State government, is talking about projects in agriculture in the post-COVID era.
Ogun State, southwest Nigeria, is an agrarian state with large numbers of its inhabitants engaged in farming, including rice production. The state has a potential to produce an average of 60,000 metric tons of rice per annum. This 125 hectares of rice farmland, cultivated by 180 young farmers in this location, is part of the deliberate efforts being explored to develop the sector.
Be able to show to us the level of mechanization that we're introducing to encourage our youths to come into agriculture, because and cutlass will no longer do the magic for us. We must go the way of mechanization, and that's what we are demonstrating here today on this 125 hectares of rice farm.
Technology has been used to cultivate rice at different locations from planting to harvesting, as youths are being challenged to take up agriculture for economic diversification.
Agriculture in Ogun State is technology driven, and this is a youth group and is under a youth focused agriculture. You've seen the excitement of using mechanical harvester. We also planted mechanically. These youth are making good money. In Ogun State, rice business matter. And this is a way of encouraging the youth to embrace agriculture.
Other areas of agricultural practice that the state is focusing on are cassava, cocoa, and maize, where it has comparative advantage.
In Jigawa State, the government there has recorded 23 days without a single COVID-19 case, but households in the state continue to feel the effects of the pandemic in their livelihoods. However, the state government has flagged off the distribution of palliatives to 42,312 households in the state.
It's been 23 days without a new case of COVID-19 in Jigawa state, and activities have since resumed. Although restrictions has been lifted in the state, its effect is still being felt among the less privileged. This no doubt is visible on the faces of Isa Abdullahi and his family, and this is enough to tell one how much effect the coronavirus had on their means of livelihood.
During COVID-19, we faced a lot of challenges. We couldn't go out to look for food, and even if we go out, we don't see work to do. Sometimes we don't even have food to eat.
We suffered a lot during this time. Sometimes we eat from leaves because of hunger. It came to a point when all our money finished and we had nothing to eat. I used to sell firewood before COVID-19, but now I don't have the capital to run the business.
The state government, in collaboration with private partners, has flagged up the distribution of palliatives to over 42,000 households. As the government makes efforts to cushion the effects of the pandemic on all, residents hope that the state will continue to maintain its status that will make them stay free of the virus.
Let's go now to some cheery news, this time from the United States, where it has donated 200 ventilators to help Nigeria manage the effects of COVID-19. At the handover ceremony in Abuja, the American ambassador to Nigeria, Mrs. Mary Leonard, commended Nigeria's response to the pandemic, saying the U.S. government is committed to further supporting the country beyond the over $54 million spent since the outbreak of the virus. While receiving the donation, Nigeria's Minister of Health, Dr. Osage Ehanire, highlights the need for further collaboration towards finding potent vaccines and cure for the virus.
Congratulations. Let's clap. Let's put our hands together.
Call it a promise kept, and you may not be wrong. The presentation of these 200 ventilators to the Nigerian government is a redemption of the promise made by the American President Donald Trump in April this year to assist Nigeria's response to COVID-19 with modern ventilators.
Thank you very much.
The U.S. ambassador to Nigeria describes the gesture as an indication of a robust diplomatic relationship which both countries have sustained for over 50 years.
Our support includes training.
She also applauds Nigeria's response to the pandemic, assuring the government of continued support.
Nigeria is now one of just 2 countries in Africa to have an oxygen roadmap that seeks to fight against pneumonia, hypoxemia, and now COVID-19. While we all continue to face unprecedented challenges as a result of COVID-19, I would like to laud Nigeria's efforts in taking early action to combat and mitigate its spread.
Receiving the donations on behalf of the federal government, the Minister of Health highlights the urgent need for further collaboration towards finding potent vaccines and cure for the virus.
This donation consists of 200 modern ventilators, as I have just seen, which, as we all know by now, are a critical component of the response strategy to save the lives of persons who have been severely impacted by this viral infection. I wish to conclude by requesting the United States government to lend its full weight to global efforts to find efficacious therapeutics and vaccines to neutralize the threat of COVID-19 to the global community, and to guarantee fair allocation to all countries and people.
As you know, that the United States has expressed some reservations about the practices of the WHO, and so we're currently looking at ways that we can work through other partners, but without undercutting the financial commitment and the commitment that we have to international health. And I expect that that will continue.
In April this year, President Muhammadu Buhari had a telephone conversation with President Donald Trump, where the US president promised to assist Nigeria with ventilators. The gesture will no doubt enhance the efforts of the government to save more lives during this pandemic.
Frequent, thorough hand washing with soap and water is one of the best ways to prevent the spread of infectious diseases, including COVID-19. Like a cold, coronaviruses are spread through droplets from a person coughing or sneezing and potentially via contaminated surfaces. Good hygiene is key to avoiding spreading it and catching it. Hand washing with soap is simple but effective, but only 42% of the entire population has access to basic hygiene, and that's according to the World Health Organization on UNICEF. The other 58% either lack hand-washing facilities with water or soap or don't have provision for either. These statistics are even more worrying in light of Nigeria's growing population, which is currently estimated at 200 million. A routine assessment of the status of water, sanitation, and hygiene services, otherwise known as WASH norm statistics, states that only 11% have access to basic water, sanitation, and hygiene services. 68% use basic drinking water services, 4 liters average per capita volume of water per day. For the rural population, 9% of markets and motor parks have only basic water and sanitation services, and 6% of health facilities have basic water and sanitation services. 47 million people still practice open defecation, while only 11% of the population has access to complete basic water, sanitation, and hygiene services. Against this backdrop, millions of people are unable to practice frequent hand washing with soap and thereby increase their risk of being susceptible to infectious diseases such as COVID-19. I'm now being joined by Mr. Zaid Georgi, Chief of Water, Sanitation and Hygiene Section at UNICEF, who I'm told he joins us from Toronto in Canada. Good evening, Mr. Georgi. Thank you for your time this evening. Welcome to the program.
Good evening, sir. Thank you so much.
Now, we're focusing on the issue of water because all the conversation has focused on water, but very few people understand the fact that there's a problem with water, isn't there, especially when we talk about Nigeria.
That's true, and the figures that you've quoted are figures of the National Outcome Routine Mapping, which you called NORM, that was carried out in 2018. We now have a more recent update of those figures. I mean, I wouldn't be talking about big changes, but as you rightly pointed out, the challenges are quite big. So we have only about 2/3 of the population who have access to water, and those who have access to latrine facilities are merely 16%. I mean, that's a very low figure. It's a big challenge, but again, maybe those challenges will provide us with the opportunities to make this happen, to showcase that we cannot live with a situation of WASH indicators being as low as they are right now, and that there is something that needs to happen to improve those figures, especially that the SDGs to which Nigeria has committed itself to achieve, the SDG 6, are only 10 years away from now.
There is, of course, the issue of mainstreaming sanitation and hygiene in epidemic preparedness for things like COVID-19. But before we even get to that, we already have a water, sanitation, and hygiene crisis. Take the issue of open defecation, for example. 68% of the population is still practicing that, even though you did say that there are even more recent figures. Do those figures show an improvement on the situation, or is it the same or in fact worse?
There is an improvement. In fact, it's 24%. These are the figures of 2018. And in 2019, the figure has become 23%. I mean, still, it's a big number, 23%. It's one of every 4 Nigerians practice open defecation. That's big. Nigeria now is occupying probably the first spot. India was number 1, but India has made drastic changes. Now the problem is here, and something needs to be done about it. There has been some successful examples, but these examples will need to be replicated at the different states and at the different LGAs. And it's a responsibility of the entirety of the communication. It's of the population. It's the responsibility of federal government. It's the responsibility of state government. It calls for the involvement of everyone. But this is not difficult to achieve, and it should start by proper awareness, raising awareness of people, so that they start to know what the problems associated with open defecation are. They will start to change their attitudes, and eventually they will start to change their practices and claim the construction of their own latrines. This is what we want to happen.
With reference specifically to water and its availability in the era of COVID, particularly because one of the most important protocols that's been put in place has to do with washing of hands frequently with water and soap. Now, in many of the rural areas, as some of the pictures that we've just seen show, the water there really can't be described as water for hygiene, can it? What do we need to do? What does Nigeria need to do now to improve this situation, and in a hurry?
I'm afraid that nothing could be done in a hurry in that respect. Here we are talking about, especially when it comes to water services, we're talking about the construction of the infrastructure that would be able to deliver those services. As you pointed out at the beginning, we have only 68 or 70% who have access to water. This figure will need to increase to 100. Of course, this is a basic service that should be accessible by all Nigerians. You also spoke about the quantity of water that is received by each person. Now the figure is around 9 liters per capita per day, when the sphere standards that we try to achieve in an emergency situation is 15. 15 liters per capita per day is the minimum that people could have access to. And then there is the quality of water. About 2/3 of water that is used at household level was found to be contaminated by E. coli. And of course, I mean, this is a very bad combination, because eventually people will need to have access to water that they could drink without becoming sick. That's the ultimate objective. As I said, it requires the collaboration of all. Investments will definitely have to increase, but then apart from the investment, you cannot achieve everything with money. There will need to be the political will. Now, the political will is there at the federal level, but it has to be cascaded down to the state level. Leaders within the state will have to take the responsibility. It has to become a national priority. Investments have to be increased, and investments have to be made in the right place. Almost always, investments are made to do capital investments. We construct systems, but then once the systems are constructed, we forget about the fact that those systems will need to be sustained. Just like anything else, you buy a car, you don't take it to the mechanic, it will break down. The same is with water systems. But sustainability will need money, and people will need to be at that level of awareness where they need to contribute to a tariff system to support the day-to-day operations and maintenance. Only 16% of Nigerians pay a sort of a tariff, and this is not continuous even. So this is something that will need to happen. Everyone will need to get together so that we can progress with the indicators, and again, as I mentioned, meet the SDGs by the year 2030.
In 30 seconds, if you could just give me this answer, do you think we will meet that by 2030?
As I said, challenges usually yield into opportunities. Nigeria is that unique country. It's the biggest country in Africa, biggest economy in Africa. Nigeria has water resources, Nigeria has oil, Nigeria has brains. It's a matter of putting this together, making sure that the will is there, bringing everyone to the same level of responsibility, and things will happen.
Mr. Zaid George, Chief of Water, Sanitation and Hygiene at UNICEF Nigeria. Thank you so much for joining us this evening and for your perspectives on this topic. Thank you very much.
Thank you.
We'll take a break, and when we return, we'll expand this discussion and take in the public health perspective of this. Please stay on with us. Welcome back to our COVID-19 update. 290 new cases of COVID-19 in 24 hours brings Nigeria's total confirmed cases to 46,867, and with 160 new discharges, the total number of recoveries now stands at 33,346, while Nigeria's fatality numbers hit 950, with 5 deaths reported within 24 hours. This leaves the total number of active cases at 12,571. A breakdown of the latest figures across the states show that 15 states and the FCT account for Monday's positive cases. Lagos and Plateau recorded 82 cases, Oyo 19, the FCT 18, Edo 16, Kaduna 15, Enugu and Ogun 9, Kano and Kwara 8 each, Cross River and Ondo 5, as well as Rivers, Ekiti 4, Imo 3, and Borno 2. A total of 319,851 COVID-19 tests have been conducted nationwide. That's about 1,600 tests per a million sample. Simply put, only 0.16% of Nigerians have so far been tested. In Niger State, the government is following up on reopening of schools with the distribution of safety equipment for secondary school principals. The state's COVID-19 confirmed cases still stand at 226, while the death figure is 7. Here's Emperor Simon with an update.
It's the second day of school reopening in Niger State, and the government is not leaving any stone unturned. On Friday, the government had a sensitization meeting with administrators and principals of schools from 25 local government areas. The state government is going further to match words with action by providing necessary safety equipment to the schools. We are currently at the Education Trust Fund office here in Mina, where the teachers and the principals have turned out to collect their equipment.
The principals are the main stakeholders of the schools. So that is why you can see that the principals are here to make sure that every measure to prevent the spread of coronavirus is prevented in our schools. We are bringing in the students and then the teachers to make sure that nobody is affected. And I want to thank the state government for this gesture. You can see all these things are supplied for us to make sure that everybody is safe.
Before today, we held our meeting with the staff, informing them what to do and what to do as the students come in to the school. So they observed that the temperature taking, the hand wash and the rest of it. It was okay, and there was a massive turnout of the students.
According to the State Ministry of Education, beyond just giving the principals the equipment, they've also been taught on how to use them.
In compliance with social distance, we have reduced the number of chairs and tables in the schools. We have equally spaced out the beds so that if, for example, we have 10 beds in a hostel, we've reduced the number of beds to be 5. And also we have sensitized the teachers as well as the principals on how to use some of these safety items in compliance with what the federal government has directed all states.
That's the update from Niger State. Emperor Simon for COVID-19 update.
Thank you, Emperor. Many schools reopened this week after the government's prolonged lockdown due to the COVID-19 outbreak in the country. However, the resumptions in some of the places recorded low turnout of students than expected. In some states, the parents simply refused to let their children return to school as COVID-19 cases rise in the country.
Despite directives by authorities for exit students and teachers to resume on Monday, August the 10th, turnout was poor in many of the public and private schools visited in the Kaduna state capital. Those who did show up returned to a different environment from that which they left more than 4 months ago, when the coronavirus pandemic forced a shutdown of schools nationwide. Desks are spaced out, class numbers are smaller, while use of face masks is now compulsory.
So excited to be back, to be done with exams and see my friends. There are a lot of changes. The hand sanitizer, the washing of the hands and the social distance, which is so good.
We are prepared because we have enough classes to accommodate the students. And we have already observed the distance in the social distancing. We make the student into 15 per class, according to their subjects.
Exit classes also resumed in Bauchi State with strict observance of safety protocols. In Government Day Secondary School, the examination hall, which has the capacity for 400 students, has been converted into a classroom to accommodate 80 students only in order to achieve social distancing.
The students are not allowed to come into the school without washing their hands and without the using of face masks. The Ministry of Education supply enough face masks for the students. Each student receives his own by the gate before entering into the school. And the seating arrangement in our classes, we want to ensure social and physical distances in the classes. So it is only students are being allocated a seat.
Meanwhile, public and private schools in Zamfara State have been reopened for exit classes ahead of the senior secondary school certificate examinations. Most of the schools in the state capital are enforcing the use of face masks, hand sanitizers, and washing of hands before entry into the school premises.
All the measures which the state government and the federal government asked us to put in place, we did that, and as you can see within the school premises, the students are ready with their face masks, the hand sanitizer, and what have you. Even the school itself, we have everything in place.
There's been intense debate about the risk to children and teachers to resume for study, and if such resumption will aid a second wave of COVID-19 infections in the country. Authorities in charge of managing the pandemic have continued to allay fears of the public that there will be strict monitoring of adherence to the COVID-19 protocols to ensure the health and safety of students, teachers, and other administrative staff is not compromised.
Central theme, the availability of water. Joining us now on the program via Skype from the Ikoyi area of Lagos is a consultant public health physician, senior lecturer in maternal and child health at the College of Medicine, University of Lagos, Dr. Alero Roberts. Good evening, Dr. Roberts. Nice to see you once again on the program.
Good evening, Laddie. Very nice to be here. Thank you for having me.
We're having some difficulty with the issue of water now. Some of the figures that were reeled out earlier in the program, as well as some of the things that the UNICEF representative who appeared earlier on talked about, indicates that water is a big problem and that this came before COVID. This has been around before COVID. What's your take on all of this?
Well, unfortunately, Laddie, we are very well aware of the abysmal figures and indices that were described earlier in the program. And sadly, it hasn't gotten any better. Despite the fact that this is one of the sustainable development goals, and despite the fact that the president did declare a state of emergency where water, sanitation, and hygiene is concerned, the fact of the matter is that, as Zaid Jerji said, this is not something you just go to the supermarket and pick a solution off the shelf. There has been so many efforts by foreign governors and international NGOs to partner with our government to improve these indices. We are the next biggest country. Now that India is meeting its goals of stopping open defecation, the spotlight has turned to the next biggest country that is doing this, and that is Nigeria. The fact of the matter is that less than 40% of the population have access to proper sanitary toilets for even the open defecation. And now we have the issue of this global pandemic to deal with, where access to running water, hand washing is a key and critical public health intervention towards mitigating the spread of the disease.
There are those who will say that, well, if we don't have too much water available or good, clean water available, we can talk about hand sanitizers. Is there a difference between what water can do and what hand sanitizers can do?
Absolutely. Hand sanitizers are really just a short-term stopgap. You're out in town, maybe you've gone to the market, or you're just coming from the bus stop, or you're in the office or in the school, you touch the door handle, the rails, and it's just a stopgap so that you can quickly sanitize your hands before maybe, say, scratching your eye that may be itching or your nose that may be itching. It is not actually the solution to making sure that your hands are free of infection. Ultimately, one will still have to wash their hands with soap and water. Soap destroys the virus. The virus is one of these things, has an oily coat. So contact with soap and the rubbing actually destroys the virus, which then has to be rinsed away with running water. So it's not the sort of thing that you can just put soap in a bowl the way we do in the bukateria and just, rinse your fingers slightly and then your hands will be clean. No, we do need water. And water means that it's not just even, because we had this argument with one of the organizations that I'm consulting on towards safe opening. And, they wanted to provide a tap and a sink for running water. And now we have the issue of water management. Where do we get the water from? How is it piped in? How do we deal with the wastewater runoff? These are all issues that cannot be solved overnight. We need an overhauling of the water and sanitation hygiene processes in the country, and it's more of a health and safety engineering issue than merely just us talking about it. We will keep talking about it. There's not much more we can do, but we do need commitment from the very highest levels to make sure that it comes to reality.
Well, if you're looking at your screen now, there's some picture of what some would call water. It's what some people actually get as water. I'm not too sure that could be defined as water from streams, muddy streams, and all of that, particularly in the semi-urban and even in some cases, the rural areas. This is possibly the opportunity for other infections to take hold apart from COVID-19. And they have been taking hold, haven't they?
There has been. We've had issues of cholera epidemics. This is the reality for so many Nigerians. It actually breaks my heart when you now think that women have to deliver and newborn babies are being born and they're using this kind of water to wash and to clean the baby or to prepare food for the baby or to bath the baby. It is actually heartbreaking when you consider that young children are trying to be educated, but this is the kind of water that they have to drink or being used to prepare food. And then we've got the issue of intestinal helminthiasis, worm infestations in children. We have the issue of the cholera and the other infantile diarrheal diseases. There's even an issue of blindness that is associated with poor water supply. Trachomatis, which is a huge problem in parts of the country, is a problem. And all these have impact on the health status of the country, on the health status of the Nigerian people, and ultimately on the health burden that is being placed on the health system. It is actually something that we really need to tackle at the very highest level with every effort that we can muster.
Let me quickly give you this so that you give the opportunity to dispel this. Someone did mention that they wanted to know if you had someone washing his or her hands in a sink or in a washing basin, and that person splashed water onto someone who was nearby and so on. Is that dangerous, since even if you are properly kitted, you're probably not covering your hands, you're covering your face and your nose? Is that a dangerous thing to happen?
Not if there's soap in the water, because like I said, soap destroys the virus. So if the person has washed their hands with soap and rinsed it in a bowl of water, it's not ideal, but it is still not as the splash to another person standing by or even onto that person themselves will not be that dangerous, no. But as long as there's soap in the water.
Thank you for that, as long as there's soap. The discussion, of course, about soap is one for another day. But as a throwaway or as a last point on this, I want to ask you about something we will be taking on during the course of the week, which is the issue of enforcement of face masks wearing. Now there's a presidential directive to state governments to enforce this, especially in the wake of the numbers that we are now having, although in recent times they've dipped. So there's a possibility that the momentum may not be where it was when the president gave that order last week. What's your take on the presidential directive?
It's a little too late, but at least it's there. We have to simply enforce mask wearing in public places. We just must. We've done it with seat belts. We've done it with cigarette smoking. We must do it with face masks because ultimately it has been proven that wearing a face mask can reduce transmission by as much as 40%. That means if two people are wearing a mask, we can get a combined reduction of transmission by as much as 80%. It's a no-brainer. If you are caught without a mask outside, government is permitted to sanction you, perhaps harshly too, so that those people that wear masks and then wear them under their chin. Hello? How does that make any sense? Masks or face coverings must cover the nose and mouth so that there's a reduction of transmission. And yes, please, sanctions are very welcome.
Indeed. Thank you so much, Dr. Roberts, Dr. Alea Roberts, for your perspective today. As always, you give us a lot to chew until the next time you speak to us. Thank you so much for joining us on the program.
Thank you very much for having me.
Let's go outside our shores to the United Kingdom, where its Director of the National Health Service, Dr. Layla McKay, has said that the NHS faces a, quote, potentially catastrophic winter if COVID-19 cases creep back up at the traditional time of maximum pressure on the service. Dr. McKay warned that NHS staff are already exhausted and overstretched. This comes a day after the country revealed its worst job numbers in more than a decade. Our London correspondent, Juliana Olainka, gives us an update from the UK.
As summer draws to a close, the attention of the British government lies squarely on autumn. The season should see the opening of schools and, according to British economists, a job tsunami in the labour market. The predictions surrounding the unemployment surge were affirmed by today's data released by the Office for National Statistics. 730,000 people have lost their jobs in the UK since March this year. 81,000 jobs were lost in July. Income has fallen by 1.2%. The most worrying part of these gloomy figures is observers believe that this data is lagging. Once the government furlough scheme comes to an end in October, according to a recent survey, 1 in 3 firms plan to slash their workforce. The British Chancellor has ruled out extending the scheme.
So my heart goes out to everybody who faces the prospect of losing their jobs. And with sectors, you talk about travel in particular, and most people in the airline industry think the recovery won't happen for at least 3 or 4 years. Now, I don't think it would be tenable to provide support over that period of time. But what we do want to do through our plan for jobs is give people new opportunities and fresh hope at what is unquestionably going to be a difficult time for many.
For the British Prime Minister, another difficult task is at hand, convincing parents and unions that schools are safe enough for pupils to attend in September. Despite an acknowledgement that the prolonged period at home could have devastating consequences on the lives of children from poorer backgrounds, as September nears, anxiety is on the increase.
It's not right that kids should spend more time out of school. It's much better for their health, their mental well-being, obviously their educational prospects. If everybody comes back to school full-time in September, it's our moral duty as a country to make sure that happens.
As the South Coast enjoyed some of the hottest temperatures not seen in this country in years, tens of thousands of people flocked to the beaches this past weekend. While the infection rate once again is on an upward trajectory, prioritising what path Britain should take will remain a cause for great concern for the Conservative government. Juliana Olayinka, reporting for Channels Television News in London.
Let's talk to Juliana now. She joins us from the British capital, London. Good evening, Juliana. You're not yet at the beach, so I guess it's safe to say you're keeping an eye on what's happening with the NHS. So let's begin from there. The NHS already overstretched, already overworked, but they're anticipating that there'll be more work ahead.
Well, they are anticipating there'll be more work ahead. I've got to say, we've got sweltering heat here in the UK at the moment. So even though I'm not on the beach, tens of thousands of people are, and I'm sure you saw that from my previous report. The Prime Minister, Boris Johnson, did mention a couple of weeks ago that he is expecting a new wave of coronavirus. Some people are calling it the second wave. Other professionals are saying it's the same wave that hasn't gone anywhere. And that's really one of the issues that Britain are facing at the moment. We've got increased quarantine procedures coming back in if people have decided to travel abroad during the summer. Those who have decided to stay, there's a term at the moment called staycation for those who decided to holiday within Britain. But the problem is when people gather together in those great numbers, there is a rise in infection. And that's what we're seeing. I believe today there were 1,400 new coronavirus infections detected in the public. That's the highest rate in about 7 weeks. And we are likely to see this increase, which is why the autumn is such a key focus for the government at the moment.
While that is going on, another moving part is the possibility of the resumption of schools early next month and all the controversy that we've seen that bring in other countries apart from Britain. How is that playing out? What are you hearing from those who may be asked to release their children for this purpose come September?
Well, it's difficult. I think now it's mainly the voices of the trade unions or the unions and some of the teachers' societies that are not really comfortable about starting school in September. Again, that's the beginning of the autumn period. We already know that we're likely to see a rise in infections as it gets colder in this country. And I believe the teachers don't feel as if they've had enough consultation with the government. The Education Secretary, Gavin Williamson, did try before the end of the summer term to get pupils back into school. That failed miserably. Only a small percentage of parents brought their children back to school. And so they are asking, is it going to be safe? I think the British media, I'm sure, Laddie, you know how outrageous they can be sometimes. And at the peak of this period, there was discussion that children could even be super spreaders. So those fears still remain in parents. But Boris Johnson did say that it's a moral duty to get those millions of children back to school, particularly for people from poorer backgrounds who may not have had access to digital technology and to their parents and their teachers. So this is a major issue, but Boris Johnson thinks that they will be there come September.
The issue of unemployment now looms very large because what has kept most people in work all along has been this furlough scheme whereby the government took up the job of paying the salaries of workers. But that's going to come to an end. And from everything you've told us down the weeks up till now, that could also be potentially very damaging.
Well, absolutely. We had earlier today the first set of gloomy economic figures out of Britain, and that was the unemployment figures showing that 773,000, nearly 750,000 people have lost their jobs since the start of the lockdown. Last month alone, 88,000 people lost their jobs. Today, Debenhams became the latest high street retailer to announce job cuts. That's 2,500 people. And the more stories we hear of this, and I can tell you, Laddie, we're hearing them every day, the more the unemployment market increases. We know that the furlough scheme is coming to an end in October. The Rishi Sunak, the Chancellor of the Exchequer, as well as Andrew Bailey, the Bank of England, have backed that idea because at the end of the day, it's the taxpayer that will have to pay this money back, and it cannot go on forever. Last week, the Bank of England did say that they believe up to 1 million other people could lose their jobs. So we're all waiting for that. And then, of course, tomorrow we've got UK Q2 GDP figures.
Those look like they're going to make for quite grim reading from here and from everything. But Thank you so much, Juliana. Of course, we trust that you'll bring us those figures, grim or otherwise. Thank you for your time.
Thank you.
The World Health Organization may be asking Russia to put the brakes on using its vaccine announced earlier in the day because the global agency has not received enough information on the drug to evaluate it. Assistant Director of the WHO Regional Branch, the Pan-American Health Organization, Jarbars Barbosa, says the organization is in contact with the Russian regulatory authorities and awaits information on this vaccine, and that the WHO will only be in a position to make a recommendation having analyzed all the information and data. He pointed out that for any vaccine to be endorsed by the WHO and made available for purchase by the WHO's revolving fund for vaccines, the vaccine needs to be pre-qualified by the Global Health Agency. Here's our global update.
Russia, which has nearly 900,000 coronavirus cases, says it has developed the first vaccine offering sustainable immunity against the virus. President Vladimir Putin says the country's health ministry has given regulatory approval for the vaccine after less than 2 months of human testing. He adds that one of his daughters had used the vaccine and that she was fine after having had an increase in temperature. The health minister says trials of the vaccine would continue, involving thousands of people. Meanwhile, the World Health Organization says they are in talks with Russian health authorities and are discussing the process for possible WHO pre-qualification.
We are in a close contact with the Russian health authorities, and discussions are ongoing with respect to possible WHO pre-qualification of the vaccine. But again, pre-qualification of any vaccine includes the rigorous review and assessment of all required safety and efficacy data.
Indonesian President Joko Widodo says the country hopes to start producing coronavirus vaccines by January if late-stage human trials prove successful. The president was in Bandung, West Java province, to launch the Phase 3 human trial for a COVID-19 vaccine candidate developed by China's Sinovac Biotech Limited and Indonesia's Bio Farma, which will involve as many as 1,620 patients.
After 102 days, we have our first cases of COVID-19 outside of a managed isolation or quarantine facility in New Zealand.
In other developments, New Zealand has detected its first locally transmitted coronavirus cases in more than 100 days.
As of 12 noon tomorrow, Wednesday, August 12th, we will be moving Auckland to level 3 restrictions for a period of 3 days until midnight on Friday.
Prime Minister Jacinda Ardern said 4 people tested positive from the same household. The source of the infections is not yet known.
That's our COVID-19 update program for tonight. You can take a closer look at some of the COVID-19 global numbers in real time by visiting our website, channelstv.com. There you'll find more updates and better understanding of all that is needed to stay safe during this period, including the fact that wearing a face mask on your chin is the same thing as not wearing a mask at all. And of course, there are other stories on politics, business, and sports. Do join us for the first edition of COVID-19 Update tomorrow at noon, and then there'll be updates at 6 and 9 p.m. Thank you very much for watching. I'm Ladi Akari Duluale. To stay safe and good evening.